right. Going live in 3, 2, 1, 1.5, 0, maybe quite there, probably live already. Hello, everybody. I'm Dave Saunders. Welcome to another conversation with clients, which we like to call Convos with clients, because we abbreviate everything. And today, my special guest, all the way from his secret headquarters somewhere in Chesterfield County in a home office, working 20 hours a day for the last 3 months, maybe 4 months. And I want to get your title right, Jeff.
Okay.
The Executive Program Advisor to the Commissioner of the Virginia Department of Health, Jeff Stover.
Thank you, Dave. It's a pleasure to be here.
You got it. Jeff, it's like talking to an old friend. You know why?
Why is that?
Because we are. Jeff and I have known each other for a long time, since our boys were 1 year old. To give you an idea how long that is, both of those boys are now well over 6 feet tall, and both of those boys are going to JMU in a couple of weeks.
That's correct.
That's right. So Jeff and I have known each other for a long time. We've worked together on various things through the years and everything else. Jeff's working on something that's really exciting because, Jeff, congratulations to you. Congratulations to the commissioner. Congratulations to your hardworking team over at VDH. Yesterday, the governor announced that the exposure notification app that you've been working so hard on is the first in the nation. That has to give you some pride.
Yeah, that's a great thing. We're very pleased about that. You know, we're not always first, right? You strive to be doing the best work that you can as quickly as you can. Sometimes you're leading the pack, sometimes you're not. In this instance, I think we found ourselves out in front. So there's some risk associated with that, right? Anyone who's out in front, but you know, we think this is really important. It's valuable in the fight against COVID-19. So we're happy to be in this position.
Jeff, your name was all over media yesterday. You were quoted in every single newspaper in the state. You were on different television stations, radio stations, everything else. I'm going to surprise you with a little bit of info, okay? Day before yesterday, the search term Jeff Stover turned up 5,800 results in Google. Today, it was 17,800. So you are internet famous, my friend.
Thank you, sir. Much appreciated.
No, the campaign really was long. And part of the thing is, and Dr. Oliver said from the podium, basically also with the hard work, you're the man behind the scenes in terms of getting this thing together, right? So how did this come about? So we have other states like Utah that developed a GPS tracking system, right? That developed apps that tracked people, that had their data, and the public said, we don't want this, right? And so it didn't really work. And then Google and Apple put together a framework. And then did they contact you or did you contact them?
Yeah, so first of all, I'd like to just comment that, you know, this is an absolute team effort, right? I've been helping to shepherd it, but there's a lot of people involved in this, from development to administration to marketing, that we couldn't have done what we've done in the amount of time that we've done it in without a whole host of really, really good talent. So having said that, I think the apps that came out initially, you know, I think there were, as the idea of this kind of thing was coming out, you know, there was a lot of people coming out of the woodwork, looking at flashy apps that tracked, you know, lots of things. And in the world of disease surveillance, we do that kind of work, right? I mean, we track things like, you know, where outbreaks occurred and what happened and those kind of things. So that's not uncommon in the disease surveillance world, but from an exposure notification perspective, it's a whole new ballgame. So a lot of different entities were coming out with ways to do that. Some states, you mentioned Utah, came out with apps that did location tracking. And I think there were attempts to do that in other states. I think the North Dakota may have done something similar. And I think in other countries, there may have been similar attempts. And yeah, they were met with a lot of resistance because it's one thing, this is my opinion, I think it's one thing to share your location with Target, if that's what you want to do, because they're gonna use that to market to you. It's a whole nother thing to share your location with the government. So I think that's where the resistance came from. We were aware of that. We decided that was not an angle that we wanted to take. So when Apple and Google came out with their framework, which is a very unique collaboration, I'm not sure that those two tech giants have ever worked so closely on something as this. I could be wrong, but they have really joined hands in this fight to really do something that can be for the betterment of the communities. So once they did that, we jumped on board with looking at apps that could take that angle, which is how we ended up where we are.
So it was really funny. I was talking to someone last night on Facebook when they said it, and they were spreading all kinds of misinformation. They were saying it takes your private data. They were saying it tracks you, and then they were saying, yeah, basically Google and Apple, they're working together to track you and do this sort of stuff. And I'm like, so first off, Google and Apple already track you, okay? And if you have an iPhone or you have, but the other thing is, they were like, yeah, they're just in it for the money. So Google and Apple got together with no cost to build this framework, essentially, and gave it open source to the world. They've already been using it in Germany. They've been using it in other countries. And then you guys got a app developer to make it customized for Virginia, right?
Correct.
So I was saying that, yeah, the Google and Apple, this public-private partnership is something that I think is really, really important. This isn't necessarily the government creating something to track you, right? This is private industry solving something and then partnering with the government to make sure that we're all better off, right?
Correct.
Because I don't think Google and Apple have a financial reward to kind of corner the market on contact tracing applications, right? Or disease notification systems. I mean, that's like, there's no money in this. So I was trying to explain that to somebody. That Google and Apple, out of the goodness of their kind of corporate hearts, said, like, we can solve this because 3/4 of Americans don't want to turn over their private data, right? But then 3/4 of Americans, according to surveys, say, yes, I would like to have some sort of notification system to warn me about COVID. So balancing these two kind of things, it seemed like that they came up with a really great technological framework that protects people's privacy and doesn't track them with GPS. Can you explain a little bit more about how the app works? Because this part of it is important because it's an educational part of the campaign.
Yes. So thank you. This is a very important question. So thanks for asking that. I think the best way to think about this, first of all, this framework, when you think Google and Apple framework, you should immediately think Bluetooth, right? There's nothing else associated with it. It is Bluetooth front and center and completely. So what that means is it's using, it's using the strength of signals that are coming out of Bluetooth technology in order to measure the distance and time related to someone who may have been positive, right? So to back up slightly, so everyone who has this app, if you and I happen to be sitting here and we're having lunch instead of having a virtual conversation, we're within 6 feet of one another, right? And if we both have the app, we have random tokens on our phones that are changing every 10 to 20 minutes. They change every 10 to 20 minutes to maintain anonymity, okay? So, but they also will share with each other. So we know our phones, our phones don't care our names or anything else about us or where we are, right? What they do know is that we're within close proximity. And it'll also know how long we've been there, right? So if we're there having lunch, it's going to take more than 15 minutes, right? So now we've been sharing, our phones have been sharing these Bluetooth signals, and we're within a 6-foot radius. We can measure that by the strength of the signal, right? The closer you are to your Bluetooth speaker with your phone, the better the reception, right? The further away you get, the worse. It measures how close you are. Same principle here, right? So it's going to do that. If I later, 3 days from now, I get tested for COVID and I'm positive, right? What's going to happen is the health department is going to be contacting me. That has nothing to do with this app, right? That's normal operating procedure. Okay. So those are the contact tracers. We've all heard about them on the news, right? So a case investigator in our example would be contacting me because my positive COVID case went through the mandated state reporting process, and it was received at the health department, probably about the same time as I got my result, right? Because most of them happen electronically. So they're going to be contacting me, usually within about 24 hours, to say, hey, Mr. Stover, we received the result, and have a chat with me, talk to me about things, right? Make sure I've got everything lined up I need to, self-isolation. What does that mean? What should I do? How do I protect my family and friends and colleagues, right? All those things. Part of that discussion would also be, Mr. Stover, by the way, have you downloaded COVIDWISE? Why, yes, I do have it. Excellent. So we would encourage you, and it's your discretion, we would encourage you to report that positive result anonymously via COVIDWISE. It's good for your community. It'll be good for Mr. Saunders, whom we don't know who you are, but you happened to have lunch with him 3 days ago. And so if I choose to do that, they're going to give me a PIN number, okay? A 6-digit unique PIN number that I would put into my app. When I do that, it goes to a server, and those PIN numbers then are checking against other devices, and they're going to match up with you.
So I'm going to pick it up from there, Jeff. So you get that basically, and I have the app downloaded right here. Okay. It was really easy. It takes 30 seconds. And basically it doesn't ask me my name. It doesn't ask me where I live. It doesn't ask me anything really at all. It basically just says, would you like to be notified? And so I go in and I turn on my Bluetooth and I say, I want to be notified. Today I open up the app and it says my exposure notifications are on and no exposures detected.
Right.
That's cool. That means yesterday, and like 17 people I came across yesterday, I mean, so far, and again, we don't know. You got to go a few days in the future and give this thing a chance to work with all the downloads that we had yesterday. And I would want to know, right? I mean, like I was trying to think of how the basic fundamental thing that I'm trying to get across to people is, if I was exposed to COVID-19, I would want to know. Right. And an exposure notification system notifies you. All right. I was trying to think of something else. What else do I get notified about? Well, the drugstore notified me, let me know my prescriptions are ready. Right. Puritan Cleaners let me know that my dry cleaning was ready. Right. I get notifications all the time. Right. But like, why wouldn't I want a notification from the state letting me know if I'm likely exposed to COVID? So I think that's one of the things about this technology that I think is pretty important.
Right.
One, the other thing is, proud that Madison+Main has our phones in the COVID fight, right? So this is up on our social stuff right away. I posted this stuff out on Facebook. The response has been amazing, Jeff, in terms of companies and nonprofits, universities. Talk about how important it is to reach out to organizations to get them to spread their word.
Yeah. So, every organization, every business, every school, right, institutes of higher learning, et cetera, they all have their own communities, right? They've all got their own customers. They all have people who follow them. And in the case of this app, what's unique about it, in a sense, is we really have to reach everybody. And Virginia is an extremely diverse state. And we need to reach out to all corners of the state, all languages, every culture that we can think of, to reach people. And so doing that with having a wide variety of supporters is huge where this is concerned, because those businesses and organizations and institutions have easy ways to reach their customer base, right? Or their student base, et cetera. And that's going to be critical. I hope a lot of people have already seen what's gone out in the past day, but this is only the start, right?
We're
and
not
we need
even
to keep
24
doing
hours into this, Jeff. The governor announced this 2 o'clock yesterday afternoon. It's 12 today. That's like, or 12:15 already. It's amazing the response that we've gotten already. One, Derek, who you know, our superstar copywriter here, who's been working hard on your campaign, is posting some stuff in the links as we speak. One, I want him to have post up the www.covidwise.org website. So you can go there. You want to read about it? You go there. You got questions? We got answers. You want to go get the app? You can go get it in the Play Store. You can get it in the Apple Store. So first and foremost, he's putting that in the link right now. The other thing I want to let people know is if your business or your nonprofit or your institution of higher education, if your church group, if your church, if your softball team, whoever it is wants to get involved and let people know that our phones are in the fight, okay, you're going to give me an email address. You send it to COVIDWISE@MadisonMain.com and we'll create your graphics for you. We'll give you social media posts because we're working right now with businesses, nonprofits, and others to spread the word, not the virus, right? That's the biggest message I want to get across to business leaders and other folks that might be watching this today. We got a lot of folks that work in business, a lot of nonprofits. This is a grassroots public education and public advocacy campaign. Jeff, one of the things that I want you to talk about is this. So we got millions of people in Virginia, right? A percentage of them have smartphones and a percentage of them are going to download the app, and we got a percentage of them that are not, right? It's okay, right? So that's the whole thing. It's voluntary. But for the people that that are ready to go, that want to adopt in, give me that 1.5 download statistic again, because that got lost in some of the press yesterday. You know what I'm talking about?
Right. Yeah, I do.
So downloading COVIDWISE, just a few people downloading COVIDWISE is effective.
Right.
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 And
so,
the more that
yeah.
download it, the more effective it can be. Explain how that works.
Yeah. So there was a study done at the University of Oxford, came out, the summaries about that are online. The report, I think, is to mid-April. Okay. In that report, they mentioned several things. One of them is that, approximately, 80% of a certain population of 1 million people are going to have smartphones, but then there's a percentage that don't. And they worked out a percentage to say, basically, if 56% of a population, right, were using an app like this, you could completely suppress the virus. Now, the key there is completely suppress the virus, right? That's the absolute best case scenario there ever was, right? And that's the ideal, which rarely, if ever, happens. They also mentioned, and this is the point that you said that's kind of been lost, because the media picked up on the fact that, you need 50 to 60% of uptake in order for this to be effective. No, that was to completely suppress the epidemic in that particular kind of example. So they also stated that 1 to 2 app users, so let's just use 1.5, right? So for every 1.5 app users, the estimation from the study is that you would avert one infection, right? So for every 1 to 2 people using the app, we're going to hopefully reduce infection by 1, and that's huge. And that's a point that
right? So just using the 1.5. So every 3 people that download the app, like a family of 3, you download the app, and you've prevented 2 infections.
The other way. So yeah. So for every 1.5 people in that family, right, who did it, they've potentially averted 1 infection in their community.
That's crazy good. So that means, using the same extrapolation, 150 people download it. There's 100, right? 1,500 to 1,000, 1.5 million to 1 million, right? Yeah. It's pretty easy math to extrapolate,
Yeah. Right.
The more people that download this, the more people that we are helping. I mean,
Right. And I would add to that, Dave, that these are estimations, right?
right.
But
I think
we are the first in the country, so there's not a lot of data here, right?
right,
We are creating the data as we go.
right.
So that's going to be important.
One of the last things, that I want to talk about too, and well, not last things, but we've got a few more minutes. We got 9 minutes left before we get off the program. And one, you've got to get back to work, man, because I know you've got a busy schedule, and I've only got like 4 more meetings with you today. But the one of the things that I want to get across is the right now, social distancing, wearing a mask, washing your hands, they're all things that we can do to prevent community spread, right, of COVID. We've been hearing this for a long, long time. They seem to be slightly passive things that we can do, right, to protect ourselves, right? But what I love about this app, this is an active kind of participation thing. It's an active one-time participation where you go there, you spend 30 seconds and you download it, and then it becomes passive again. And the idea that it's an anonymous notification system, because basically you're just carrying around your phone. You have it in your pocket, you have it in your purse, you have it in your car, right? It's not like I have to actively do something every day. It's not like I have to go there and do things. It's pretty passive, basically, until you get that notification, okay? Now, let's get to the other side of this. Heaven forbid, you and I are at lunch, whatever else, there's another person in the vicinity. That third person notifies us 2 weeks from now, right, that they were, or let's say 10 days from now, that they were contracted COVID-19, right, or tested positive for COVID-19. And we both got the alert. The alert comes to the phone. It says, you are likely exposed to COVID-19. And then what do I do? I mean, does it tell me to go see the doctor? Does it tell me to get tested? Does it tell me all of the above?
Right. So there's a virtual VDH component to that app. And at the bottom of the screen, if you were to hold it up, there's a notify others, etc. Over on the far right-hand corner, you'll see a thing that says virtual VDH. I think it says that, doesn't it?
Yep.
And if you click on that, that will pop up. It's like a bot, right? And so now it's going to tell me things like, oh, you received a positive test result, or you received a potential exposure notification. Click on it. It's going to walk you through things, right? It may send you to, well, it would send you to our VDH page where we have COVID check, right? Which is a symptom tracker, right? And you can see, okay, well, I am experiencing these symptoms and blah, 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 go through the process. You can find all test sites in Virginia. There's a link there. And then, getting in touch with your physicians, that kind of thing. So that's all there. And you can use it as an information resource.
Thanks. I mean, going, and I got it right here to show the folks at home basically how that works. So it does a few more things in there too, because once I'm in there, going back to getting partners and things on board, I've been overwhelmed, and we've been overwhelmed here with the response. You may be familiar with some of these right now, but the response from the business community and the nonprofit community and the higher ed community has been amazing. I'll just take 2 seconds because I know you know some of these names, but people watching the program haven't seen it. NASCAR said, yes, we're an endorser. We're all in. Richmond Raceway, Martinsville Speedway, the University of Virginia, the Hispanic Chamber, the University of Richmond, Radio One, Virginia Commonwealth Bank, Terrazzo, Union Presbytery and Cemetery, the Life Church, and just literally dozens and dozens of nonprofit organizations and companies and businesses. The list is too long to read them all. One, I know that the Department of Health thanks these organizations for sharing that information. If you had a chance to talk to someone that's sitting on the fence right now saying, I don't know if I want to send a letter out to my employees. I don't know if I want to post this stuff on social media. What's the pitch there? What's the pitch for them to do the right thing and corporate responsibility?
Yeah. So I would say, that Virginia is, in my opinion, doing a really good job of its COVID response. And I think that's witnessed by the caseloads that we've seen over time. When lots of other states were increasing, Virginia was holding steady, right? We've been doing things. We don't want to do them, right? We don't want to have to social distance. We don't want to necessarily work from home. We don't want our students to be at home. But the things that we've been doing have worked. We've seen cases go back up. I agree. That's to be expected when it's happening all over the country. But suffice it to say, I think Virginia has been a leader in this respect. And COVIDWISE is one more example of that.
Right.
And I think our corporate partners and our businesses and those throughout Virginia can look at this as a way to say, we're all in this together, right? You know, this is a community activity and we're going to do our part and we're going to get out there and we're going to beat the bushes to get our customer base and our friends and families involved in this and show the rest of the country exactly what Virginia can really do here. We're out in front. We did it first, and everyone's going to be watching to see how successful we are.
Awesome. I want to cut that clip down and I want to send it to a couple hundred businesses.
Okay.
Good job. Hey,
all right.
You know, one thing I was thinking about too is I forgot like the best 4-letter word in marketing. Like how much does the app cost? It's free. Yeah. Right. Yeah. Can you imagine? Like, yeah, it's like it's $3.99 a month, like your Apple subscription. No, it's free.
Right.
We're giving you this thing. It's free. Go to the App Store now. So it's amazing. The number of reviews in the App Store already is just like crazy good. It's like 4.9 on the review. Got a couple of like, you know, malcontents in there giving it 1 stars, but by and large, people are giving it 5.0s. Same thing in the Google Play Store. Lots of downloads. We're going to have information on that later. I don't want to spoil the surprise yet, but people have been going there. COVIDWISE.org. They've been checking it out. I know you've been working hard. I want to give you some good advice and some words of encouragement. So first of all, thanks from the Madison+Main team. It's good to be working with you again.
Yeah, absolutely.
When I started this agency in 2005, I got a coffee mug from Apollo 13, right? From the Space Center, Kennedy Space Center. Can you read it?
I can.
Failure is not an option. We've been through 2 recessions. Matter of fact, Madison+Main spent half of its life in a recession here. 15 years, I think 8 of it seemed to be in a recession. That's our motto. So, and I think you've got that in you too. You've seen this thing all the way through. Failure is not an option. And I know this is going to be successful because of you and your team over at VDH. We're happy to be a part of it. So thanks.
Yeah.
Any other parting words for the Facebook audience out there? What's the parting shot? What do you want them to do?
I think go if you're skeptical, you know, go to covidwise.org, you know, check it out. I think you'll find all the information. We are 100% transparent about this entire process. There's no hidden agenda. There's nothing that we've left out, you know, purposefully or anything else not to share. It's all there. So, you know, if you're not sure what Bluetooth technology is and how it works, you know, we can chat with you about that. And then, you know, the more people we can get who go out and serve as kind of train the trainers, right, as to how that process works would be great, because this takes a village. And in this instance, the village is Virginia. So we appreciate everybody's help and support.
Absolutely. And if you're a business or a nonprofit, any sort of organization out there that would like to get involved in this initiative and get your your media materials, your social media graphics, your messaging, your letter template, so you can send it to customers, employees, donors, members, send it to me, COVIDWISE at madisonmain.com, and let us know. I'll check in with Derek to see if we have any questions there that we answered so far.
All good.
All good. He's been answering questions on your behalf in the chat. So
Right.
Jeff, I know you're a busy man. We're at the 30-minute mark. Once again, thank you. Thanks for doing Convos with clients.
Yeah, it's my
I
pleasure.
guess in a few weeks when things die down, we're going to go have a bourbon.
And thank you for y'all's help. We appreciate what you're doing. And let's keep it going. All right.
You got it, buddy. Thanks
All
again,
right.
Jeff.
Okay.
I'll see you.
Okay.
Bye. Okay.
Yeah, perfect. I'm glad you threw in